Around the world, the right to health of millions of people is increasingly coming under threat. Uh, we hear about conflicts, uh, prolonged one and acute ones, the effect of climate change, the effect of global warming, and all the impacts on health, on people. And also, we know that millions of vulnerable and disadvantaged people do not have access to good quality health care. So for this year's World Health Day, the theme, My Health, My Right, was chosen to champion the right of everyone, everywhere to good quality health care.
How does the WHO define the right to health, and what are its key components?
The right to health is the right to a set of social arrangements, including institutions, services, systems, and enabling environments that help people to be healthy. So the right to health is not only limited to right to health care, it encompasses rights to underlying social determinants of health, including good housing, clean water, energy, security, education, and so on and so forth. Must be available in sufficient quantity, be accessible to everyone, financially, geographically, and others, and must be acceptable culturally to everyone. And it must be of good quality, safe, and effective.
In your view, what are the biggest barriers to achieving health equity in Africa?
One is inability to have sufficient data that will allow us to know those who are actually left behind, where they live, what they do, and what can be done in order to bring them forward. That is one barrier. Two, the inability of people to be aware of their right to health is also a barrier, so they cannot demand for those rights in an effective manner. And then three, the lack of support from communities and civil societies to adequately help those who are vulnerable and disadvantaged to demand for their right to health.
So, how can individuals and communities get involved in advocating for their health rights?
Individuals and communities can let people know that they have the right to health. It is not a luxury. We can also help in supporting evidence to understand those who are left behind, to know where they are, to know who they are, to know what barriers they face, and to also work together in order to co-create remedial actions that we can implement together with the people that we have identified that are left behind. These actions, when we co-create with the vulnerable and the disadvantaged groups, they have become very practical. They are owned by everyone, and they can be easily implemented at the community level with concrete results coming out of it.
What are the key priorities for WHO in promoting the right to health as part of its agenda?
WHO is integrating the human rights based approach to health within its support to member states, highlighting that we should not leave anyone behind by supporting assessments to identify the gaps in policies, strategies, and programs. We also support programmatic implementation, and we have to monitor to ensure that all people, everyone, everywhere, covered by health programs and the multi-sectoral actions that are supporting people in order to achieve their rights to health.